And Jason, I do have a question that did come in. What is the role for a PET scan after a radical prostatectomy?
Where we're using PET scans, and this is kind of the first indication that we have, and that was the Oxumum study, is that when there is a biochemical recurrence, when the PSA starts to climb after a prostatectomy, that's my preferred imaging modality, because we know based on the literature, it's more sensitive and more specific than standard conventional imaging. So that's where we would use it in a question of a prostatectomy failure or a biochemical failure.
And so the question always comes up is it like, how low of a PSA is it worth getting the scan? Like at what point? Because people ask me this all the time. Is it time now to get that scan? So I'm just kind of curious. I mean, we know that the statistical likelihood of a positive scan is higher with the higher the number, but when do you consider a level high enough to warrant to be scanned?
I will do it as early as possible. You look at some of the Oxumum data, you see, obviously the higher the better, but if you get below 0.8, you can still get some positive results. And that can be pretty significant in how you manage these patients, because if you find disease outside of the pelvis, or you wouldn't consider radiation therapy, but if you find disease in the pelvis, you would consider pelvic therapy, pelvic radiation. Or if you find disease outside the pelvis, you may consider stereotactic, very focused radiation to the metastatic site. So I always try to get it. We know the numbers aren't as good as when it's higher, but the reality is these are the patients that we're seeing. And when you look at the most recent data for biochemical recurrences, and it's the Empire trial, which we can talk about, which is probably, I'm sure Tom loves that trial. But the Empire trial was fluciclovine, an Oxumum study after patients who were treated with surgery. There was an 80% basically positivity rate or finding in patients following surgical failure.
Wow.
Yeah, and I think to add on, I mean, Dr. Hafron and Jason mentioned all the reasons why we want to get it early. We know if we're going to do salvage radiation after prostatectomy, to treat with a minimal burden of disease or a lower PSA, patients have better outcomes. So if we wait longer to get the, better results on the scan or to find something, potentially we're missing a chance to have a better outcome with salvage radiation. So, I'm with Jason, somewhere between 0.2 and 0.5 is when I would order the scan. And I am using that to make decisions for treatment, because if the scan is negative elsewhere, I'm going to do pelvic radiation, and I'm going to do it at a point where it's most effective. But if the scan is positive somewhere else, then we have to talk about different options.
So
and I think what's important too, Michael, let me just add on to what Tom said is, with what we've, one of the newest trials that came out is the Empire 1 trial from Oxumum. It was the Oxumum study. And what they did was patients who failed surgery, half the group got just standard CT bone scan. The other half got CT bone scan plus an Oxumum scan. And what they found was the patients that got the Oxumum scan plus the conventional imaging, and this is why I think this trial is so powerful, is that in 3 years, 13% of the patients that got the Oxumum scan prior to their radiation had an improvement in progression-free survival. So they had less events, less PSA recurrence, less progression of disease. And when you look at that at 4 years, the numbers even get wider, and you see 24% of the patients that got the Oxumum did better with less PSA progression, less PSA recurrence. So we know that these tests, these imaging is better than standard conventional imaging, but now we're starting to see data, specifically this Empire trial, which showed that we're improving outcomes. Patients are doing better when they get a PET imaging, which is kind of the next frontier for all these imaging tests. We know they're better, but now let's just show the utility and show that the patients actually do better, they live longer and have more successful outcomes.